Okay, guys, a very common question that you're going to get are what are the contraindications of cryotherapy, right? Obviously, some you're going to be asking, and then there's others that they're going to tell you and come out right in the consultation or when you're speaking to someone about how you can help them. So sometimes when I say that you're going to ask them, it may be an elderly male or female that you just happen to want to just get some more information, Sherlock Holmes style. You want to try to extract information from this person and say, hey, do you happen to have any medical issues that we need to know about? This is before you even get to the informed consent that you're going to have them fill out, the waiver, right? You may say, hey, are you dealing with any heart issues? Or do you have a high blood pressure? These are very common ailments that an older gentleman or female may have. So it might be a question that comes out right away from you. But most of the time, these contraindications are going to come when they start to fill out the waiver. You don't even have to ask anything yet. They're most likely going to see it on the waiver themselves. So they're going to see, are you pregnant? If the answer is yes, it's there for a reason. They're going to say, hey, I'm sorry, I didn't realize I couldn't, I'm in my first trimester. Will that matter? Well, yes, it will. You're not able to get this therapy when you're pregnant, or if you have a stent in your chest, you have heart disease, you have a pacemaker, right? You have high blood pressure. Some of these contraindications they're already going to see them on the waiver, and they're going to ask you about them. But obviously, the more common sense ones and the ones that you're going to hear the most are heart-related conditions or ailments, and also pregnancy, high blood pressure, any medications, and there's a lot of other things that you're not going to be knowledgeable enough because it's too medical based. And you're going to find out in the waiver when they fill it out. And if they say yes to one of them, then you know. Right? Now, sometimes especially if you think something may be going wrong with this person, like I said, you can kind of tell they look really unhealthy, or like I said, they may just be an older gentleman or older female. You may want to say, hey, I think it's important that we get the green light from your physician. Maybe you need to ask your doctor if this is okay for you to get this type of therapy, right? Always err on the side of caution. Remember, safety is everything. Safety first. So contraindications are definitely there. Once again, if they're lower than 14 years old, we talked about this on another video, they can't come in. That's our rule. They have to be 14 years old and up, and they have to have a parent or guardian that signs for them, and they need to be on site during that session. That's our rule. So contraindication for age is 14 years old. That's the lowest we go. And then obviously the other ones that you're going to see and you're going to be asked about from the medical portion of that informed consent. All right, so there's your contraindications. If you guys have any other questions regarding those, you can ask Todd or I, or you can always get the green light from the doctor. If you don't feel comfortable working with somebody, you can always say, ma'am, sir, unfortunately I can't help you today until I have the green light or permission from your physician and doctor. All right, that's it. Caution, err on the side of caution, safety.